Hey there! Welcome back to our channel, Back to Curiosity. Let's cut to the chase. Today we're discussing a serious update from the World Health Organization. MPOX, previously known as monkeypox, has once again been declared a public health emergency of international concern. This comes just 15 months after the last MPOX emergency ended. So what's changed? And why is the world on high alert again? Let's dive in. In the past few months, a concerning strain of the MPOX virus has rapidly spread across Central Africa, prompting the Africa Centers for Disease Control and Prevention to declare its first-ever public health emergency on August 13th. The very next day, the WHO followed suit, calling for global cooperation to control the outbreak. This isn't just another isolated outbreak. The virus is spreading in densely populated areas and crossing borders, affecting new countries like Burundi, Kenya, Rwanda, and Uganda. The situation is particularly dire in the DRC, where over 2,400 suspected infections and 56 deaths were reported in just 1 week in early August. Now let's talk about the virus itself. Evidence shows that the strain currently spreading in Central Africa, known as clade worse, is more lethal than the strain that caused the 2022 global MPOX outbreak. Clade I has historically been confined to rural areas with limited healthcare access, which might explain its higher death rate. But now, this strain is showing up in cities, making it a far greater threat. Given the severity of the situation, rapid action is crucial. The WHO's declaration is a call for countries to provide resources for better surveillance, treatment, and containment. But there's a major challenge. Vaccines and treatments are still largely unavailable in African countries. Anne Rimoin, an epidemiologist, speaking about the global implications of MPOX outbreaks, said in an interview, "I hope that we've long gotten over the idea that something happening far away can't affect us. An infection anywhere is potentially an infection everywhere. We need to act now to prevent this from becoming a global crisis." Unfortunately, the situation is dire when it comes to vaccines. The Africa CDC is negotiating with Bavarian Nordic, a biotech firm in Denmark, to secure 200,000 doses of their MPOX vaccine. But this is a far cry from the 10 million doses needed to control the outbreak. Even if the deal goes through, delivering these vaccines to remote regions with poor public health infrastructure will be a massive challenge. Now, you might be wondering, why is it so hard to get vaccines where they're needed? Well, it's not just about supply. The effectiveness of these vaccines against the clade wearer strain is still unclear. Plus, getting vaccines to stigmatized populations like sex workers and men who have sex with men adds another layer of complexity. One major concern is that, just like during the COVID-19 pandemic, high-income countries might stockpile vaccines and treatments, leaving African nations without the tools they need to fight the outbreak. Experts like Rimoin warn that our best bet to control outbreaks is to equip the countries at greatest risk with the necessary resources. So what's next? The WHO's declaration is a crucial step, but it's just the beginning. Countries worldwide need to coordinate their efforts, share resources, and ensure that vaccines and treatments reach those who need them most. Jane Kaseya, Director General of the Africa CDC, speaking at a briefing, said, "We are in negotiations to secure vaccine doses, but this is only the start. We need global solidarity to ensure that we can contain this outbreak and prevent further loss of life." As we've seen time and time again, an outbreak anywhere can quickly become an outbreak everywhere. It's not just about Africa, it's about all of us. So let's hope that the world heeds this call to action before it's too late. Thank you for watching. If you found this update important, please like, share, and subscribe. And don't forget to hit the notification bell so you don't miss our next update on this evolving situation. Stay safe and stay informed.